Case number 3. A 6-month-old boy with a history of frequent infections is brought to the emergency department because of stiff muscles and difficulty feeding. On examination, he is found to have a carpopedal spasm, and tapping on his face in front of his ears leads to a spasm of the facial muscle. What is the most likely diagnosis? This child has DiGeorge Syndrome, or 22q11 syndrome, which is characterized by hypoparathyroidism and T-cell deficiency. Severe combined immunodeficiency may cause both B and T-cell deficiencies or T-cell deficiency exclusively in a given host. Hyper-IgM syndrome, IgA deficiency, and Bruton A gammaglobulinemia all primarily affect B cells. What is the etiology of this condition? DiGeorge syndrome is caused by a developmental defect involving the third and fourth pharyngeal pouches. It results in a hypoplastic thymus and parathyroid glands. Laboratory tests of this patient would show hypocalcemia and low T-cell count. The hypocalcemia causes tetany and carpopedal spasm. Chvostek sign involves tapping on the facial nerve in front of the ear and observing spasm of the facial muscle. It is another indication of hypocalcemia. This patient is at risk for developing what type of infections? Because of the aplastic thymus, patients with this disorder have ineffective T cells and are particularly susceptible to viral and fungal infections. What abnormality may be observed on an X-ray of the chest in this patient? An X-ray of the chest in a child with DiGeorge syndrome may show a reduced thymic shadow. What other abnormalities are associated with this condition? Catch-22 is a mnemonic for the 22q11 syndrome, which involves a deletion in this region of chromosome 22. Clinical manifestations include cardiac abnormalities, abnormal facies, thymic hypoplasia, cleft palate, and hypocalcemia. Velocardiofacial syndrome also arises from this gene and involves cardiac abnormalities, abnormal facies, and cleft palate.